This is Dr. Chen. Now I'm going to introduce the Scalp acupuncture. Scalp acupuncture is a therapeutic method by needle specific area or lines of the scalp. There are many schools of thought about this subject. Among them, only one, the acupuncture method based on a combination of the acupuncture method of TCM and the functional location of the cerebral cortex in the scalp is introduced here. This is performed by needling the corresponding projection area of the cerebral cortex on the scalp. First one, we introduce the MS1. MS1 middle line is middle line of the forehead. MS1, its location is on the forehead. One trend line from 224 straight down along the 2 channel. Its indications headache for headaches, deafness or conjunctival congestion with the painful swelling and epilepsy, which we call also for autonomic imbalance like insomnia, depression. It also can treat for nose, tongue, or throat disease. Okay. This is MS2. It's lateral line 1 of the forehead. We call MS2. Location on the forehead, one turn long straight from braided 3 straight down along the braided channel. Indication for respiratory system disease or heart disease, such as asthma, bronchitis, and angina pectoris, or rheumatic heart disease, and so on. Again, we talk about 3. MS3, lateral line 2 of the forehead, we call MS3. Location on the forehead, one turn long straight from gallbladder 15 straight down along the gallbladder channel. Indication for acute or chronic gastritis, pain result from peptic ulcer or liver or gallbladder disorder, spleen, stomach, liver, gallbladder, or pancreas disease. We are talking about MS4. Okay. Lateral right 3 of the forehead, we call MS4. Location on the forehead, one turn along straight from the point 75 turn medial to stomach 8 straight down. Indication for kidney, bladder, or reproductive system disease, like dysfunctional uterine bleeding, or diabetes, or impotence, or pain in the low abdomen. Now we are talking about MS5. Okay. Middle line of the vertex, MS5. Location on the head from 220 to 221 along the 2 channel. Indication for low back pain, leg pain, or knee pain, such as paralysis, numbness, prolapse of the anus, or neck urea, or vertex headache. Okay. about MS6. MS6 is location. Okay, location is on the 221 to gallbladder 6, run through 3 channels with dual channel, bladder channel, and gallbladder channel. Okay, it's anterior oblique line of the vertex temporal, we call MS6. Location on the head from the anterior and for anterior we call 前顶 is 221. Okay, to gallbladder 6. Okay, it's very important. So say we talk about second time. Okay, now we talk about indications. It's a little bit complicated. Okay, the upper 1/5 of the MS6 is for paralysis of the contralateral lower limb. Okay, and the middle 2/5 of this area for paralysis of the contralateral upper limbs. Okay, and last one, the lower 2/5 of this area for contralateral central facial paralysis, motor aphasia or salivation and dysphonia. Okay. Now talk about MS7. It's posterior oblique line of the vertex temporal. We call MS7. Location on the head parallel line, 1 turn posterior to the anterior oblique line of the vertex temporal, from 220 to gallbladder 7. Indications, also complicated a little bit. Okay. The upper 1/5 of the posterior oblique line of vertex temporal M7 is for pain, numbness, or paresthesia of the contralateral area, leg, occipital headache, pain in the neck area, and tinnitus. Okay, and the middle 2/5 of this area is for pain, numbness, or paresthesia of a contralateral upper limb. And the last one, the lower 1/5 of this area is for contralateral facial numbness, migraine, or trigeminal neuralgia, or toothache, or temporomandibular arthritis. MS8. Okay. Lateral line of the vertex, MS6. Okay, the location on the head, 1 point train lateral to the 2 channel, 1 point train long straight from bladder 7 backwards along the bladder channel. Indication for low back pain, leg pain, or paralysis or numbness, even for headache, dizziness, tinnitus, or blurred vision also can be used. Okay. And next, 9. Lateral line 2 of the vertebral, we call MS9. Location on the head, 2.25 turn lateral to the 2 channel, 1.5 Chun long straight from gallbladder 17 backwards along the gallbladder channel. Indication for shoulder, arm, or head or hand disease like paralysis or numbness or pain. Also for headache, migraine, or dizziness. Okay. Now MS10, anterior temporal, we call MS10. Okay. Location on the temporal area, a straight line from gallbladder 4 to gallbladder 6. Indication for migraine, headache, and pain of the outer canthus or tinnitus or epilepsy. Also for peripheral facial paralysis, we call paralysis. Okay. Now, MS11 is posterior temporal MS11. Location on the temporal area is straight line from gallbladder 8 to gallbladder 7. Okay. Indication for migraine headache, dizziness, or deafness or tinnitus. Okay. MS12. Location upper middle line of the occiput. MS12 location is on the occipital area, a section of the two channel from 218 to 217. Indication is for IDs, low back pain, or lumbar vertebral pain. Okay, like spinal problem. Okay, spinal problem. Also, it's for neck pain or epilepsy. Okay. 13. Upper lateral line of the occiput. MS13. Location on the occipital area, 1.5 Chun, long line, starting from the point 0.5 Chun lateral to 17, straight upwards. Okay. Indication is cortical visual disturbance and cataract or myopia, IDs, or athlete foot or lumbar spinal injury. Okay, spinal injury is quite hard to be treated. So it's for clinical stage, is useful. Last one, MS14, a low lateral line of the occiput. MS14, location on the occipital area, 2 Chun long line, starting from the bladder 9. Straight downward. Indication is for equilibrium disturbance caused by cerebral disease or pain of the head, occipital pain, and the neck or dizziness. Neck pain also quite useful in this area. Okay, all about introduce. Okay, thank you for listening. Bye now.